Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. For the first, I will introduce myself. My name is Jaka Pradika. I'm a lecturer from Sekolah Tinggi Ilmu Keperawatan Muhammadiyah Pontianak, especially in the Medical and Surgical Nursing Department. In this occasion, I will present the result of my research, and the title is Solution and Techniques of Current Wound Cleansing, a literature review. And I will also introduce of my team members. My team consists of Mr. Karisma Pratama, Dr. Suryadi, Mr. Syahid Amrullah, Dr. Haryanto, which they are come from Sekolah Tinggi Ilmu Keperawatan Muhammadiyah too. And the other members of my team is Professor Diah Aryani Perwitasari and Dr. Rita Maliza. They are lecturer from Universitas Ahmad Dahlan Yogyakarta. They are a lecturer from Pharmacy and Biology Faculty. Okay, for the outline of my research, consists of the first is about background or introduction, and then methods, and then results, and then conclusion, and the last is acknowledgement. Okay, for the first is I will explain about the background. As we know, death wound and laceration are common complaints that bring patients to the emergency care centers. Acute and chronic wounds that are not handled properly will cause problem. The big problem is infection. Infected wounds are one of the reasons patients visit health facilities such as hospital, and then health centers and clinic to get treatment and care. For the problem that arise in the wounds, there must be a solution to overcome it so that the condition doesn't getting worse. One solution is to apply for the right wound management. As we know, that's wound management. There is three phase. The first is about cleansing. The second is about the debridement, and the last or the third is about dressing. One of the initial phase or the first phase of wound management is wound cleansing, where this phase often doesn't getting special attention. So sometimes it is not done properly. In wound cleansing, the thing that needs to be considered is the use of the right solution and technique. Wound cleansing technique and solution must be safe and comfortable for the patient without allergic reaction, can clean during dirt, reduce the number of bacteria, and not damage granulation tissue. But there's a different opinion about solution and technique in wound cleansing. Therefore, this literature is very important to be carried out with the aim of knowing the effectiveness of the right wound solution and technique in the latest wound cleansing, which is expected to provide an overview relates to wound solution and technique that can be applied in wound cleansing. This is for the identification, screening, and eligibility for the article. And then methods. This recent method is a literature review to shed and selection of the article in the preparation of this literature review was carried out through searching the result of scientific publication using the PubMed and then Science Direct and then Wiley Online Library and Cochrane Library Database. That's range 2010 to 2020. For all countries, full text in English and free of charge. The keywords in this research is wound cleansing or wound cleansing solution and technique. There were 23,992 articles identified and published from 2010 to 2020. Based on the result of a screening and identification, only 9 articles met the criteria. For the result, the safest liquid used in wound cleansing for all types of wound is normal saline, with a recommendation of 40 to 100 milliliter per square centimeter of wound space as the minimum amount to be able to clean the wound optimally. This solution is considered safe to use because it is isotonic, doesn't have cytotoxicity, doesn't cause allergies, doesn't damage tissue, and it is non-antiseptic solution and has no effect on biofilm. In addition, normal saline, another alternative liquid that can be used is sterile water. Sterile water is like a bottled water or drinking tap water. However, for infected wound, a solution that can reduce the number of bacteria that have antimicrobial properties such as frontosan is needed. While the technique applied in the article discussed are swabbing, bathing, irrigation, or swearing, but the common and easy to apply is the swearing technique, namely by irrigating the wound with certain pressure. For the conclusion, there was no significant difference in the use of paste on frozen wound cleansing solution and technique. The use of normal saline is still the main choice in wound cleansing because it is safe, non-toxic, and doesn't damage tissue, and it is easy to obtain a fairly affordable price in packaging that maintains sterility. And the techniques that's common use, safe, and easy to apply is the swearing technique with a certain pressure according the recommendation of 4 to 15 pounds square inch, where the pressure is the range is considered safe and effective for wound cleansing without causing trauma to the wound bed. And for the last is acknowledgement. Alhamdulillah, thanks to the Ministry of Research and Technology, the National Research and Innovation Agency, which has accommodated and provide the opportunity to researchers to conduct research in the health sector, especially in wound care. The author also expressed high gratitude to Sekolah Tinggi Ilmu Keperawatan Muhammadiyah Pontianak, West Kalimantan, which is very supportive of all form of research carry out. I think that's all of my presentation. Thank you so much for your attention. Assalamualaikum warahmatullahi wabarakatuh. Good morning.